Hey guys, in this video we are going to go over the hip palpation. To start our hip palpation, we'll start with long axis distraction. I'm going to have my patient scooch over to the edge of the table here, and then I'm going to bring their leg out and bend their knee. My contact is down here at the distal femur, and then I'm going to be contacting on the lateral aspect of the hip here. I'll use my own body weight to lean back and feel the distraction that exists at that femoral head. My next two palpations are internal and external rotation. So, with my patient in a 90-90 position here, I will produce external rotation. So bring that foot in, and then internal rotation here, we're just assessing for joint play. We're not necessarily assessing for degrees of motion. Next, we'll do an A to P palpation. We do an A to P palpation. We make sure that our contact is okay with our patient. So we'll have communicated with our patient beforehand, telling them that we're going to be touching in kind of the front part of their thigh. So what you'll do is you'll find the femoral head out here on the lateral aspect, making sure that your hand is placed in a way that your fingers are pointing out. Then you'll stabilize over here on the posterior aspect of the ilium, and then provide an A to P force here. Next, we'll do a S to I inflection. So we'll start by flexing our patient here, having a shoulder contact. Obviously, we've spoken with our patient beforehand here about our contact, but we're going to be very deliberate with our contact. It needs to be on that proximal femur here. So I'm going to bring the leg out, establish my contact here, and then challenge S to I. The last palpation is P to A. So I'm going to ask my patient to please roll over onto our stomach. And when we do our P to A palpation, again, we're going to be touching in a very sensitive area, so we need to make sure that our patient is aware of our contact. Again, touching at that proximal aspect of the femur, the area of the femoral head as it enters that acetabulum. Your finger contact is pointing straight out here, and then you're going to grab the ASIS out here and challenge straight down P to A. This was the palpation of the hip.